number 19 of the House of Commons Standing Committee on Human Resources, Skills and Social Development and the Status of Persons with Disabilities. Today's meeting is taking place in a hybrid format pursuant to the House Order of January 25th, 2021. The proceedings will be made available via the House of Commons website. The webcast will always show the person speaking rather than the entirety of the committee. Pursuant to the order of reference of Wednesday, February 17th, 2021, the committee will commence its consideration of Bill C-220, an act to amend the Canada Labour Code, Compassionate Care Leave. I'd like to welcome our witnesses to begin our discussion with 5 minutes of opening remarks, followed by questions. We have with us Matt Genereux, the Member of Parliament for Edmonton Riverbend, representing the Canadian Cancer Society, Kelly Mazzotti, and once she has her technical issues resolved, Helena Sonia. Ms. Mazzotti is the Vice President of Advocacy, and Ms. Sonia, the Senior Manager of Advocacy. And we also have from the Canadian Grief Alliance, Paul Adams. For the benefit of our guests, I'd like to make a few additional comments. Simultaneous translation is available. You have the choice at the bottom of your screen of either Floor, English, or French. When speaking, please speak slowly and clearly. When you're not speaking, your mic should be on mute. We're going to start with the sponsor of the bill, Mr. Genereux. Welcome to the committee, sir. You have 5 minutes for your opening statement, and you have the floor.
Well, thank you, Mr. Chair, and it's good to be in this seat here for once. Before I get started on my remarks, I just want to simply say a huge thank you to you and members of the committee for agreeing to make Bill C-220 a priority. To interrupt your ongoing business to study our bill just means so much to me, but also to the many stakeholders. So again, Mr. Chair, thank you. Now, it's an honor to appear before this committee to discuss my private member's bill, Bill C-220. I'm also very pleased to appear alongside my friends, the Canadian Cancer Society and the Canadian Grief Alliance, who I know will help answer any questions we might all have about this bill. Currently, the issue facing many families when facing the death of a loved one is the amount of legislated leave. Right now, under Canada's Labour Act, Canadians are only able to take 5 days, with only the first 72 hours being paid. Now, this has gotten better with the passing of bereavement leave, but we've all heard that it's simply not compassionate enough. The leave still ends within days of a loved one's death, leaving little time to take care of practical necessities like funeral and estate planning, and most importantly, grieve. I've heard from many people who have taken the leave that having to return to work so soon after the death resulted in more lost work time down the road. They ended up having to take more time off to process the death and to grieve. Bereavement has become a topic that we as representatives must continue to discuss. We've seen 20,000 Canadians die from COVID-19 in the last year. Many have had to say goodbye to their loved ones through a pane glass window, and those are the lucky ones. That leaves thousands of Canadians to grieve while trying to juggle their job and other personal responsibilities. Grief impacts all people differently, and while some people might want to return to work quickly, that's not always the case for others. It's important to have bereavement supports in place for Canadians, especially as our population ages. Now is an important time to be talking about grief and its impact on workers. Every Canadian will be impacted by grief at some point in their lives, and this fact has been especially poignant during COVID-19. My final topic that I'd like to touch on before I turn the floor over to the experts is the nature in which this bill was drafted and now in the process of being amended. I've said in the House of Commons, I've said it in public, I've said it during countless media interviews, but a real success of this bill has been the collaboration around the importance of supporting grief. I want to again thank the many stakeholders who have weighed in over countless hours while we explored this topic, especially our friends in the Canadian Hospice Palliative Care Association, and particularly the Alberta Hospice Palliative Care Association, where this idea all began. But I also think it's important to recognize the tremendous support offered from the Minister of Labour and her parliamentary secretary, the member from Mount Royal. This is a real story that really does need to be told. Working across the party lines with the Bloc Québécois member from Thérèse de Blainville and the NDP member from Elmwood-Transcona is a real example of parliamentarians working together to truly make our country better. is because of all their tireless advocacy that we today have an opportunity to make more bereavement supports available to working Canadians. Enacting these changes will help millions of right when they need it the most. Thanks again, Mr. Chair, for having me at your committee.
Thank you, Mr. Genereux. Next, we're going to hear from the Canadian Cancer Society. Ms. Mazzotti, for 5 minutes, please.
Good afternoon, Chair, committee members, and fellow witnesses. My name is Kelly Mazzotti. I'm Vice President of Advocacy at the Canadian Cancer Society, and hopefully my colleague Helena will be joining us at some point in time today. Thank you for the opportunity to discuss with you today Bill C-220, enact to amend the Canadian Labour Code bereavement leave. As you study this bill, we are pleased to share with you the perspectives of how a change of legislation of this kind could have an impact for the many Canadians that are diagnosed with cancer every year and their loved ones. This legislative change was needed prior to COVID-19. Our healthcare system is evolving quickly, and elected officials and governments across the country have shown incredible leadership. For that, we thank you and encourage your continued response to the evolving needs of Canadians. The Canadian Cancer Society has long advocated for increased awareness and flexibility for the needs of caregivers, specifically amending current bereavement legislation and regulation to be more flexible. The proposed bill does just that, amend the existing framework to better meet the needs of Canadians, to be more practical, and to address grief and bereavement. Prior to a loved one's passing, some caregivers' responsibilities include managing medications, equipment, home care visits, and medical appointments, personal care, preparing meals, cleaning, handling banking and financial management, and keeping family members and healthcare providers up to date. Many Canadians every day undertake this important, invisible role. While improvements are being made, there is a lack of recognition of the role of caregivers and the role of the formal healthcare and social services they intersect with every day. The peripheral role assigned to a caregiver by health and social service system can often leave caregivers feeling discounted, devalued, and not respected. Caregivers are as diverse as the Canadian population, but policies and programs that affect them seldom take into account or address this diversity. Imagine being a caregiver every day to your loved one, managing their day-to-day care and following their passing. You are expected to return to work immediately afterwards because you have no or inadequate paid bereavement leave. Family members, potential recipients of compassionate care leave, may need support as they grieve the loss of a loved one and try to manage numerous strains and stresses on their mental health. According to a recent Statistics Canada report, 1/5 of caregivers provided 20 or more hours of care to an ill family member or friend, most likely an ill spouse and child. Additionally, 68% of the surveyed caregivers said they would like to have received greater financial supports. The economic value of unpaid caregiving in Canada exceeds $25 billion annually. $25 billion annually. As mentioned previously, the needs of caregivers and bereavement leave needed to be addressed prior to COVID-19. COVID-19 has impacted caregivers' ability to attend and support their loved ones receiving cancer treatment in a hospital setting, treatment at the end of life, or being able to say goodbye. There is increasing evidence generated by our support services, our patient and caregiver surveys, and research by academia that suggests throughout the COVID-19 pandemic, caregivers are feeling increased amounts of burnout, stress, anxiety, and frustration, which is having a significant toll on their mental health. A recent Ipsos poll conducted by CCS at the beginning of February found that approximately 8 in 10 Canadians are supportive of providing financial support for a family, caregiver, or someone facing a progressive life-altering illness such as cancer. Failure to provide adequate supports and time to grieve can result in negative outcomes for a person, their mental health, and an increase in downstream costs to the healthcare and employment sectors. Bereavement programs are often part of the comprehensive care offered as part of palliative care, another gap in the healthcare system that needs improvement. By making leave for caregivers more flexible, more Canadians will have access to the time necessary to heal, minimize economic hardships. Minimize economic hardships, I'm so sorry. Failure to provide adequate supports and time to grieve can result in negative outcomes for the person, their mental health, and increase the downstream costs to the healthcare and employment sectors. Bereavement programs are often part of the comprehensive care offered as part of palliative care. Another gap in the healthcare system. More Canadians will have access to the time necessary to heal, minimize economic hardships, and help them take care of some of the most practical business, such as planning a funeral, contacting banks and service providers following a loved one's death. In summary, the Canadian Cancer Society supports the efforts of MP Genereux to highlight the need for greater bereavement support for Canadians, especially caregivers. And thanks again to the committee for their time and energy today as they consider this practical, positive change to provide people time to grieve for a loved one.
Thank you very much, Ms. Mazzotti. And I understand that during your remarks, your colleague joined us, so she'll have a chance to support you in the Q&A part of the meeting. Next, we're going to hear from Mr. Adams on behalf of the Canadian Grief Alliance. Mr. Adams, you have the floor for 5 minutes.
Mr. Chairman, honorable members, thank you for inviting the Canadian Grief Alliance to speak to you today. We are a coalition of grief experts and 150 leading health organizations, including the Canadian Medical Association, the Canadian Nurses Association, and the Canadian Psychiatric Association. We came together last spring to ask all levels of government to turn their minds to this issue of grief urgently in the context of COVID-19 and in anticipation of the deadly toll that we have seen since then. But grief is obviously not an issue just when there's a pandemic. Even in ordinary times, we as a society have been neglectful of the grieving. And that's why the CGA is pleased to be here today and support this legislation. We want to extend our thanks to Mr. Genereux and for introducing the bill and for all of the parties for supporting it. Almost every one of us has suffered grief in our lives, the loss of a mother or a father, a spouse or a partner, a child, or perhaps a close friend. If we have the time and the space to grieve and are lucky enough to have the support of family and friends, after a time we rejoin the trajectory of our lives, even if the ache of loss never entirely disappears. But what the research tells us is that when grief is complicated, if circumstances prevent us from having the space or the support to grieve, it can transform into depression or anxiety, dependence or addiction, self-harm or the thoughts of it. When this happens, it can create burdens in the workplace in terms of productivity and days lost to work. And of course, it imposes a weight of avoidable anguish on the grieving and those close to them. So far as the law is concerned, many Canadians are entitled to as little as 5 days leave when they have lost a family member, and fewer than that with pay. If you will forgive me for being personal here, I lost my wife, Suzanne, to breast cancer 4 years ago. 5 days is not long enough to organize a funeral. It would certainly not have been time enough for a family like ours with two teenage children to regain its equilibrium. I was lucky enough to be in a circumstance that allowed me to take several weeks away from work, excuse me, and I could afford to do it financially. I truly believe that that time was critical to allowing me to return to work a few weeks later and be fully productive, and for my kids to return to school and resume learning. Those precious days helped us get some of our balance back and not fall out of our orbit, as might otherwise have been the case. As a parent, it makes me shudder to think what the consequences might have been for my teenage children had we not had the time to grieve together. This bill will create a right for a significantly large number of Canadians for a more generous time to grieve, to collect themselves, and to rejoin the world of work. Perhaps needless to say, the bill does not concern itself with all the issues that the Canadian Grief Alliance believe must be addressed for a truly effective national grief strategy, for which we have also advocated. We do believe, nonetheless, that if passed, it can be a beacon to legislators such as yourselves to do more, and to the provinces who also must do their part. Ultimately, we believe that bereavement leave should be paid leave, whether through employers or employment insurance. A right is not a right if you cannot afford to access it. We also believe that there needs to be a network of grief services to support those for whom existing social networks are inadequate. However, the passage of this bill would represent a significant step by the Parliament of Canada in recognizing that grief is a collective and not just an individual responsibility. There is an irreducible sum of grief that no family or friend or Parliament can wave away when you have lost someone close to your heart. But there is a great deal that all of us can do to ensure that such suffering is no greater than it needs to be. Thank you very much.
Thank you very much, Mr. Adams. We're going to proceed now with questions, beginning with the Conservatives. Mr. Viss, for 6 minutes, please.
Thank you, Mr. Chair, and thank you to both witnesses for joining us today. And thank you, MP Generou, for bringing this bill forward. I was happy to jointly second this legislation and am pleased to be able to review it further in committee today. When I first was acquainted with this bill last year, it struck a chord with me. As Mr. Adams described a personal scenario, a personal circumstance, I had one too. In 2008, I was a graduate student actually at Carleton University in Ottawa, and my sister's husband passed away suddenly. My sister was 29 years old and was left with 4 kids alone. My sister was living in Washington State at the time, and although I wasn't an immediate family member of my brother-in-law, it would apply to my mother, who had to return to work sooner than she would have liked. So this legislation is very important and does strike a chord with a lot of families like my own, who have gone through tragic and sudden loss and are sort of left with big questions about what to do, how the bills are paid, how to do insurance claims, and having the time to sort through all that, let alone finding the space, as both witnesses rightly mentioned, to mourn the loss of a loved one. So thank you for sharing that, and thank you for indulging me with my own story. Mr. Adams, can you just, for the sake of people listening today, how is compassionate care leave different from bereavement leave under the Canada Labour Code?
I'm afraid I'll have to defer to Mr. Generou on that. I'm not really an expert on the technicalities.
Okay.
The Alliance really believes that we need to move on a whole bunch of fronts to improve the provision for the bereaved.
Okay. MP Generou, would you like to distinguish the two for us, please?
Yeah, for sure. And thanks, Paul and Kelly and Helena for joining here. Yeah, the compassionate leave under which the bill was first developed solely looks at the caregiver, and when in conversations with the minister, and rightfully so, and the parliamentary secretary, and extending bereavement from just the compassionate leave, which deals with just the caregiver, the full bereavement leave deals with those the sudden death, for example, a car accident, homicide, cases in which you wouldn't have that caregiving time at the front end of a loved one's death.
How many people would be impacted by this move to extend the length of leave past the death of a loved one, do you believe, MP Generou?
So right now we know that there's about 11,000 individuals who take compassionate care leave every year. To extend this to the death of a loved one outside the scope of caregiving would obviously be much larger. We don't know in terms of who's going to die in the future and how much time is going to be generally spent with them. But we're seeing with an aging population, and that it's just going to continue to go up and up as we see it, as we see the numbers taking the bereavement leave.
Thank you. What has the response from the stakeholder community been to this bill since you tabled it in February 2020? And will the amendments to bereavement leave still allow for flexible caregiving?
I'll answer maybe the second part, and then maybe I'll turn it over to Paul or Helena or Kelly to talk about the stakeholder aspect.
Thank you.
Seeing the response from stakeholders has been just remarkable. Lots of people have come out of the woodwork to show why this is important. You know, the Canadian Grief Alliance being very key, and a brand new organization that encompasses so many different organizations allows really shows the full scope of them. But I think maybe in the interest of time, I'll just turn it over to them.
If I could just say briefly, a critical part of why we wanted to address the issue of grief is that I think that it falls in a kind of ground that people don't fully understand. Grief is a normal, natural process. It's not a mental illness. It's not in itself a sign of ill health. In fact, just the opposite. But we do know that it can turn into something more serious, a serious mental health issue, and that's why we were concerned, especially in the context of COVID-19. And you know, the as I talked before about the complexity of grief leading to other difficulties at times. Of course, it's not just the people who've lost loved ones to COVID during this pandemic, but it's anyone who's lost a loved one, whether it's cancer or another disease, who may not be able to be with their loved one, may not be able to have a funeral in a normal way, may not be able to gather with their family and friends.
Thank you, Mr. Chair. That's all from me.
Thank you, Mr. Viss. Next, Mr. Long, please, for 6 minutes.
Thank you, Mr. Chair, and good afternoon to my colleagues. And Matt, it's great to see you. Seems like many years ago where we sat together on ethics, you and Pat Kelly and all of us on the Liberal side. But, you know, we did great work there. And I just want to congratulate you on this. And you certainly have my respect for bringing this forward. And, you know, obviously, I think MP Falk and myself were a part of HUMA in the last Parliament that studied, the study launched for M110 by MP Richards, which was a study for parents suffering the loss of an infant. And, you know, we certainly seen then during that study by the testimony that I will say was certainly compelling and absolutely heartbreaking. The need for our government to show more compassion and flexibility when it comes to bereavement leave. So I do have some questions. I'll ask them, and they can be for you, Mr. Adams, Ms. Muscati, Ms. Sonea, hopefully I said that right, and you too, Matt. So my first question is this. Our government is taking the necessary steps to ensure that when workers are experiencing a tragic event in their lives, there are supports in place. Can you tell us about the proposed amendments and how you feel they will make this bill better to ensure that workers are supported? Maybe Matt, we'll start with you.
Yeah, thanks, Wayne, and I really appreciate it. Those are fun days on ethics for sure. New members of Parliament.
Yeah.
So the original intent of the bill looking at compassionate leave was built on some of the work I did at the Alberta Provincial Legislature. But what it turned into was very specific to caregiving, which is important and needs to continue to be part of the conversation of how caregivers are supported. But with the reach out from the Parliamentary Secretary Housefather and Minister Tassi were said, well, why don't you look at broadening it to include everybody who would go through bereavement? So again, those sudden instances, you know, a sudden diagnosis of cancer where you don't have the ability at the beginning to do that caregiving, it helps to expand that general scope.
Okay, Ms. Muscati or Sonea or Mr. Adams, anything you'd like to add to that or comment?
I don't have much to add. I would agree with what Mr. Genereux just said, that any level of additional support for caregivers would be welcome. We know that when cancer patients or when individuals are diagnosed with cancer, rates of anxiety and depression skyrocket. And throughout our surveying over the last few months, we're seeing the same for caregivers, that caregivers also experience those same levels of anxiety in helping and caring for their loved ones. So broadening the bill, I think, is and the amendments suggested are wise. Any additional support for people in a time of crisis is something that we should all be very proud of and support.
Yes, absolutely. It's very much needed. Mr. Adams, you have anything you'd like to add?
I just add quickly that we have a gap in the research. We don't really understand right now fully the burden of grief, how many people grieve, the pace of grieving. Certainly there isn't much in Canada to know with precision how much time people need, and those needs would be various. I don't think we know that. So we absolutely applaud the changes, and we hope that that being more expansive, it'll be touch more people. But we also hope that in time we can have more research in this country so that we understand more precisely what the needs are.
Thank you for that. We'll go back to you, Matt. One of the proposed amendments we made to make sure that 220, the Act to amend the Canada Labour Code, is to extend bereavement leave by 5 days. We just talked about that earlier, for a total of 10 days. Can you speak to the importance of expanding bereavement leave and how this will ensure that employees are given the time they need to grieve and focus on practical necessities in the event that they lose a loved one? I know, Mr. Adams, you certainly commented on that, but Matt, I'll let you go first.
Yeah, I'll just be brief. Similar to my previous answer, it expands that scope a lot more. And what part of what we were seeing with the hurdles in the original legislation is that, as we all know, as members of parliament, we can't expand the EI component. We can't force the government to spend money. So that was always a piece of the original legislation, and all private members legislation, that doesn't allow you to move along in that step, which is obviously it's a needed step. It's hopefully a next step after we're able to pass this bill, but it's right now to be able to bring that to that 10 days sets that standard across the country, which we see 95% of the time provinces follow along with as well. So it allows us to again build that standard across the country.
Thank you for that. Anything you'd like to add, Mr. Adams?
I just want to support what Mr. Genereux said, that we see this legislation as setting a standard and setting a pathway for further steps, and also at the provincial level.
Okay, thank you. Do you want to let the Canadian Cancer Society have a brief comment on this? We're past time, but if you have anything to add, Ms. Mazzotti, go ahead.
I don't have anything to add other than I agree, Helena. Thank you.
Great. Okay. Thank you, Mr. Long. Suite, Madame.
I know. Madame Chabot for 6 minutes. Thank you very much. Mr. Chair. Hello to my colleague, and thank you for the presentation of your bill, and thank you to the other witnesses. And as you said, it's certain that for the committee to have been able to put this subject on our agenda will make it quicker that it comes back to the House for adoption. Because when you introduced it, as a colleague, I had to intervene on this bill, and I was entirely in agreement. So it doesn't completely change the world, but I think that what moved me in all this, you understood that we already supported it, and we'll come back to the amendments that are suggested with which we will agree, I'm telling you right away. It's the sensibility involved, because we know there is a leave for caregivers. Most people get compassionate leave in employment insurance, but both of these leaves had this fault that once the person died, everything ended and the person had to go back to work. And to my mind, the bill that you've presented aims to protect and especially to support the people who are there for days and weeks at the side of the trajectory of the person who has died. So I think that's what's important, is that we should never penalize anyone who would have to suddenly go back to work without giving them some necessary time to grieve. And so you have our entire support. I don't know if I have any specific questions to ask you. I have 6 minutes. Actually, I would ask you maybe to tell us if there's more that you'd like to tell us. I understand that what has been said, that the issue of grieving is not discussed a lot. It's something very private. People live it in their own way, each in their own way, and the pandemic makes it even more cruel. Even though I don't have a personal experience, I can understand what it could be. But I think we have to be able to offer flexibility, and that's what this bill aims to do, and it also aims to give support. And I think that's what we're doing, and we can do more. So if you have anything further to say.
First conversation that we had about this, a few months back, I think was enlightening from my perspective too, in terms of where the conversation on the bill went, and it's scary, I think, to a lot of people to talk about the death of a loved one, to think about that period of time. I've spoke to one senator, former Senator Carstairs, who said everybody dies, and from that at that point. Sometimes it's something you don't want to think about. You don't want to think about your loved ones passing away. But the importance of having this conversation, and the importance of Parliament having this conversation, the importance of Parliament voting in unanimous support of it is just it means so much to not just me, to the entire stakeholder community. So if it's okay with you, Madam Chabot, may I'll allow the Grief Alliance or Cancer Society to weigh in on some of that too.
Well, let me just say that, Madame Chabot, you said that this won't change the world, and I think I agree with you that it doesn't, but it's a beginning of a change. And the analogy I would use is, if you go back 30 or 40 years, there was no maternity leave effectively in Canada, and we gradually expanded, and we expanded it in kind of an iterative way over a number of reforms to a place where Canadians are more comfortable with where we are that way. So that's how I see it. I think that as the Alliance, we think besides those kind of immediate things that people may need that will allow them to grieve with their families and with their friends, that we also have to think about many people who are in difficult circumstances, may not have adequate supports, and particularly when you think about this time of COVID, there's nothing to say that you may not, if you lose a loved one, may not also have lost a business or a job or some other thing may have befallen you in your life, and those are complex circumstances. And so we think that there need to be services to support the grieving, and we think, I don't want to get too much into it now, but we think that they are different from standard mental health services because, as I say, grief is a natural process. It's not a mental health illness or something.
Thank you, Mr. Adams and Madame Chabat. Merci beaucoup. Next, Ms. Gazan, please, for 6 minutes.
Thank you so much, Chair. And I just want to start out by thanking Paul Adams for your very touching sharing about your wife. And to Kelly Mazzotti, as somebody who lost both of her parents to cancer, and had both sisters who are breast cancer survivors, I can't tell you how much admiration I have for the important work you do caring for families, especially through the disease of cancer. My question is actually for either one of you. We know that women still perform disproportionately high amount of care work within their families should a loved one get sick. And we also know that women tend to have lower earnings than men. This difference is even more pronounced in the case of racialized women. They are the ones most likely to need this leave and the least likely to be able to afford it. Making parallel changes to EI is even then more important. Do you believe it's important to make parallel changes to EI, especially considering these factors predominantly impacting women?
Absolutely. We believe, as I said in my opening presentation, that a right that you can't access because you can't afford is not fully a right. As you say, the people who I had a privileged circumstance. I did not have to worry in the same way that many people do about losing a job or losing pay, and that was what enabled us to get through it. And we really deeply believe that this is an important next step. We've created the space, but now there needs to be some mechanism to allow people to occupy that space. And beyond that, we would say that there are communities in Canada, and particularly the Indigenous peoples, who come with a burden of grief to these individual moments in their lives, and they may need services too that are specific to their needs and are different from those that somebody like me might be eligible for.
Thank you so much. Do you have anything to add, Ms. Mazzotti? Is it Mazzotti? Am I pronouncing?
Yeah, it's Mazzotti. Thank you.
Mazzotti. Yes, thank you.
This is a easy position to be in right now because I feel like I can continuously just say that I support the comments of Mr. Adams and Mr. Genereux. And so absolutely, we need to look at the EI system and make sure that there is parallel commitment there. Our organization, and not to detract from the discussion right now, but we hope to see a comprehensive approach to all levels of care. And so it is important to see this at the end. When we're talking about grief, it's also important for the cancer patient and the caregiver. And, the Conservatives introduced the compassionate caregiver benefit, which is a benefit that was passed in 2016. The Liberals supported it, and as did our organization. And so as you're looking at this, it is so important to see it as a comprehensive approach. We need support for the patients. We need support for the caregivers. We need an extension to the EI sickness benefit. We need to ensure that the compassionate caregiver benefit, that we see changes to the labor code. There are so many changes that need to be made to provide these practical supports for patients and caregivers alike when they're going through such challenging times, or when they are prepared to return to the workforce. So this is such an important issue, and I support the comments of Mr. Adams.
Thank you so much. My next question is for MP Genereux. First, I'd like to start out by thanking you for introducing this very important bill. It's certainly long overdue, and I commend your efforts in that regard. But we know that in order to benefit from additional leave, Canadians must be able to afford it. Parallel changes to the employment insurance compassionate care benefit would help Canadians so that they can continue to collect the benefit during the additional leave period created by this bill. And we want all Canadians to be able to access additional leave provisions without fearing the financial implications, and recognize that these financial concerns will impact women disproportionately, as they tend to do more of the care work and earn less income. Do you, I know it's an extension to the question I asked, but do you also believe that parallel changes to the EI compassionate care benefit should follow to mitigate these financial pressures?
Yes, and thanks, MP Gazan, for that. I think that's one of the key aspects of this bill. The not losing sight of the caregiver, I think, is the one thing really want to make sure that we're focused on, but also what comes next. So as you know, and conversations I've had with your colleague MP Blakey, is the need for EI to follow this bill. So as private members, again, we can't change EI. We can't tell the government you need to spend more money, even though I know you and I both would probably want to at some point in our days. But we wanted to make sure that outside the scope of a private member's bill, that's what follows next. So I've had very encouraging conversations with the Minister and Parliamentary Secretary and others as to those next steps.
Thank you, Mr. Generou and Ms. Gazan. Next, we're going to go to Mr. Tucker, please, for 5 minutes.
Thank you very much there. And I don't think I'm going to be taking my full 5 minutes here. Just heads up. I just a round of thank yous for everyone that made this bill possible, and obviously Matt for bringing it forward. I thank you. And to the witnesses, you can see around the table that we do have a nonpartisan support of this, which is very encouraging. And I guess it's a question for Matt is when do you think that this bill is actually going to be back and get royal assent, hopefully?
The key question, Corey, for sure. Well, hopefully all things go well today, and then after today goes back for a report stage to the House relatively quickly. Any sort of procedural measures we could use to get it quicker, the better. I know that's the question I get from stakeholders all the time, as well as when does it get to the Senate? When does it pass the Senate? When does it become a law? I think a very astute amendment that was jointly submitted by both MP Housefather and myself was that 3-month waiting implementation period, which allows, after it passes, it allows a number of the groups, organizations, the workforce to know that they have that 3-month implementation period for once it becomes law, and that's one of the amendments tabled, and I think a very smart one to ensure that it doesn't surprise a lot of stakeholders, that it'll then be you're now allowed 2 weeks of bereavement leave.
And I guess this is more of a comment to the Liberal members that are on here. I'd encourage you to talk to your leadership about getting this fast-tracked. The leadership can move on this as quick as they would like. I believe we would find the Senate is very open to debate and hopefully quick passage as well. And there's no reason why this can't be done before the upcoming election. This is too important to die on, and no pun intended. That's terrible, but it's not. We need to ensure that these supports are out there. I got a question that came up when we were talking about next steps with the provinces, and just to get a kind of a lay of the land. I'm not sure if that would be the best person to talk to. Maybe Paul, if you've done some work nationally or have looked into, is there provinces that augment their supports during this time period? Maybe some provinces that do better support programs out there for grieving people.
I think it's well, I'll defer to Mr. Generou. I think there's quite a variety of approaches across the country. I think the importance of this legislation is that a lot of provinces actually look to the federal government in terms of providing models. And I think, as Mr. Generous suggested, we would hope that those that aren't providing this level of relief to the bereaved would step in and follow suit.
And I'll just comment quickly on that, Corey, too. Had already some conversations with different provinces, and they've pretty much given the same sign that, yeah, once things happen at the federal level, they pretty much relatively quickly. I think our statistics show 95% of the time a follow case on what we do at the national level. So that'll be important, because then as soon as they fall in line, every Canadian across the country, including according to their Employment Standards Acts, will have that opportunity to access the bereavement leave.
Fabulous, and thank you again, Matt, for bringing this forward, and to our witnesses. This is consensus across party lines and from across coast to coast, and I sure would not want this not to be passed, because it would die on the order paper if we had an election before it got passed. So I would encourage everyone to do their part and make sure leadership knows that this should come through as quick as possible. Thank you, everyone.
Thank you, Mr. Tucker. Mr. Dong, for 5 minutes, please.
Thank you very much, Chair, and I want to thank all the witnesses for coming forward, and to my colleague from the Conservative Party, MP Jean Roux, congratulations on introducing this bill and being so consistent on pushing shepherd this thing forward. It's I commend you for your dedication and voicing opinions of and many individuals who experience this, because this is a tragedy to any family losing a loved one and having to worry about financial support. So this is a very timely bill. I was listening to MP Tucker's question, and I think it's a very important one. This is one of those very few bills that we that attracts members from all parties support. We are in a minority situation, so I think it's great to see from time to time such bill come forward and making sure that Canadians are getting the support that they expect from their parliamentarians. I'm just wondering, is there anything that you envision, and I'm a new MP, and you've obviously have a lot more experience in this in terms of legislative procedure. Is there anything that we can do together to make this bill making this bill pass and going forward quickly and guide the public policy that provide actual support to individuals that may find this beneficial? So it is, because we know that this will perhaps guide some changes in the EI system, the calculation of EI, the formula, and we also seen that the recent changes in EI providing additional support to Canadians. So there will be a cost factor in this as well. So what's your vision on this, and how can we move this as fast as we can to make sure Canadians that will get the right support?
Oh, thanks, MP Dong. I still consider myself a newbie. I have one term under my belt, but certainly it's first time kind of through this process. So I'm kind of learning as we go as well. The next step, obviously, being third reading and getting support in the House, which if we're all on side with that and the amendments, then it would be going to the Senate. I've started making calls to a number of senators that I know and encouraging them when it does come to help see it through the process. Would implore you to and others to do the same if in terms of helping that along, because as MP Tucker showed, if or when there's an election, these sorts of things do die on the order paper, and it's that the story of how this has started, and from the beginning to through to the amendments from the minister and the parliamentary secretary, I think are really a good news story to share with Canadians. And I would hate for all that to be put aside if we don't get it through to the Senate.
Well, thank you for that. In terms of the EI portion, and this, I think, if passed, it will bring some changes to the EI system. And just want to get your thoughts on this. And you know, do you think that there's expectation from the public that first the changes to the EI system, and then that there's expectation for Ottawa to approve this as quickly as we can?
Yeah, I think you've seen even from the stakeholders today the expectation that EI does change to follow suit with bereavement. Right now, EI covers 72 hours of bereavement of grieving, which if you put it in that perspective, thinking about the death of someone who's very near and dear to you, 72 hours really isn't a lot of time. So I think, again, under a private member's bill, we can't include that as part of the scope of this bill, but I think it's a unanimous vote in the House shows that support for the minister, and should make it clear it's not Minister Tassi, it's Minister Qualtrough that's responsible for the EI component, but making it clear that then the next steps will be to follow suit with EI to make sure it's at the very least covering those 2 weeks.
Thank you. And I just very quick question: do you see, to all panelists, do you see the coverage will be just for one caregiver, or actually it's expandable to cover multiple caregivers? And especially during the COVID, we've seen that all family put together to support individuals that needs care.
Okay.
Well, sorry.
Go ahead, Mr. Adams, quickly, please.
Just very quickly, we certainly believe that there are others than just the caregiver are bereaved and need the time. And we also believe that if EI steps up and supports this measure, then we're going to see the provinces fall into place very quickly. So that's the key order of business.
Ms. Mazzotti, do you want go ahead quickly,
just very
please.
briefly add, we would really hope to see this change come through separately and not part of a larger reform to the overall EI system. So really keeping these two issues separate to ensure a very quick implementation.
Thank you, Ms. Sania. Thank you, Mr. Dong. Suite Madame Chabot pour 2 minutes et demi.
Now, Madame Chabot for 2.5 minutes. Thank you, Mr. Chair. I'm sorry for the witness, but I would like to tell you that I would like to have in this public session, I would like us to debate the 3 routine motions that I filed. But I let you decide when we would do this, because I don't want to deprive the witnesses of the first hour in order to continue our discussions. Is that how one proceeds? Yes, thank you, Madame Chabot. If this is suitable for you, maybe we could start that after the evidence. Simply in order to be polite to the witnesses. Yes, that's what I was hoping. Thank you. So I still have 1 minute. Well, I wanted to say that I completely agree with the idea that the step we're taking with this bill is something that makes us look farther, and that's how we progressed in our social programs. It will make a big difference that there's no caregiver, there's no person who could be laid off or who would have trouble at work, because the current provisions ask them to come back to work immediately after the death of their loved one, which doesn't make sense. So yes, I think we will be able to go further. But I would say yes, amendments to employment insurance is possible. We are currently studying the employment insurance regime, and when we look at it as a whole. There are the regular benefits for the workers, but also the special benefits included in employment insurance. For example, sickness benefits that we want to increase to 50 weeks or to make the compassionate leave more flexible. But I agree that the strategy now is to focus on what we are able to change, that this be done quickly, and that we effect important change. Do you share my opinion?
Absolutely.
We also fully agree.
Merci, Madame Chabot. Next.
Thank you, Madame Chabot.
Please, for 2.5 minutes.
Thank you, Chair. And it's so nice to be at such a collegial meeting with everybody agreeing. I've never seen this as a new member of Parliament. But my question again is for MP Genereux. Under its current form, your proposed amendments do not alter the maximum entitlement of 28 weeks of compassionate care leave. Therefore, an employee who has taken 27 weeks of compassionate care leave is only entitled to an additional week after death. If the principal goal of this bill is to ensure that all Canadians can provide compassionate care beyond the week following death, do you have any thought of proposing amendments that is contingent on the number of accumulated weeks of compassionate care provided prior to death?
Thanks, MP Kazan. Yeah, it's nice, isn't it, to have collegial support at committees at times. Yeah, so under the original bill and how we structured it was under the thinking that if you've already spent a significant amount of time with a loved one, you then would only need generally a week or two to take care of the funeral arrangements, to do some of the financial considerations, those sorts of things, because you would have had a lot of time on the front end, and then the structuring of it of not having a lot of time towards the end and having more time post death was a thinking of the original concept. With the proposed amendments from the parliamentary secretary and myself jointly submitting them, meaning that it shifts from that compassionate care leave header, if you will, under Section 3 of the Labour Code to bereavement leave. So even though you're right, and that the compassionate leave, and particularly the caregiving, is I think an important aspect that we don't want to lose sight of in the conversation. It really does allow that more fulsome scope of giving those 2 weeks to everybody, if you're a caregiver or not, for the type of leave to grieve.
Thank you very much. And my last question is for anybody on the panel. We know that, having time to grieve, making funeral preparations, even wrapping up an estate after the death of a loved one is important for the well-being of Canadians. I know that our party, the New Democratic Party, has supported Canadians on compassionate care leave, having a little extra time for these things before having to return to work after the death of a loved one. Can you speak about the importance of care work?
I can't. By the time my wife died, I had been deeply involved in caring for her for a long time. The moment when she died brings you into a new phase of grief, which of course starts before the very end. But you then have the additional burden, as you say, of planning the funeral, of winding up the estate. Which, by the way, if you wanted time for that, you'd probably have to give somebody a year off. But the important thing to say is that caregivers do have this additional state of exhaustion and building grief that is on top of what may afflict other people who are close to the person who's passed.
Thank you.
Okay, thank you, Ms. Gazan. Ms. Mazzotti, do you want to offer a short comment?
I'm going to pass this over to my colleague, Helena. Thank you.
Ms. Sanea? briefly, if you
really
could.
briefly, yes, of course. So we know that caregivers are that invisible workforce for Canada. We also know that, throughout COVID-19, some of the surveys that CCS has conducted with caregivers over the past year has told us that 85% of caregivers feel more anxious and burnt out than they had prior to COVID. And so we would certainly, again, just want to reiterate the support for this bill.
Okay, thank you. Mr. Viss, please, for 5 minutes.
Oh, thank you, Mr. Chair. I wasn't sure if I was going to have any more time left. One other question for MP Genru before we wrap up very shortly. Have you heard anything from small businesses or larger employers about the impact this might have on the day-to-day operations of their business? And how have you sold this change to bereavement leave to employers?
Thanks, Brad. Honestly, haven't had to really sell it to employers. I think a lot of employers actually just understand the importance of supporting a loved one. This again, it sets the standard across the country for what employers can do. A lot of employers are generous, and a lot of small businesses will often say, take all the time you need. We want to make sure you come back in a strong mental and sometimes physical capacity. So even though it has an impact on the work life, I would say the conversations I've had have been very understanding. It was actually this committee did a report. Those of you that were on it in the last Parliament will remember the February 2019 report supporting families after loss of a child, which MP Long referenced, and it suggested in there that the costs associated with employees returning to work when they're unable to properly are higher than the costs due to the absenteeism. So the thinking of being that it would be important to support the employees was certainly the testimony heard at this committee at the time.
Thank you, Matt. And to our witnesses, any final comments you'd like to share with the committee before we wrap up soon?
I would just like. Oh, sorry. Go ahead, Mr. Adams.
Go ahead, Kelly.
I would just like to thank you. Thank you for inviting us to appear today. This is such an important topic for discussion. And like the other members, I would like to encourage that this is moved through committee in the Senate quickly. So thank you so much.
Yes, we just want to applaud the committee and applaud Mr. Genru and applaud all the parties for coming together. This is a really important reform, and we're so pleased to be part of this process.
Helena, any final comments?
No, just thank you very much, everyone, for your time and energy. Again, this is a practical support for many Canadians diagnosed with all different types of diseases every year. And it's especially important as the world shifts through our new COVID era. So thank you so much.
Thank you, Mr. Chair. That's all from me.
Okay. And the last person to pose questions will be Mr. Housefather for 5 minutes. Go ahead, sir.
Thank you, Mr. Chair. And I don't think I'm going to need 5 minutes. I want to thank Paul and Kelly and Helena for coming before the committee. Paul, thank you for sharing that very poignant, lovely story about Suzanne. And I'm deeply sorry, even if it's 4 years later. And Kelly and Helena, thank you so much for your incredible work that you're doing at the Canadian Cancer Society. I've worked with you guys often, and I really appreciate the work that you do. And Matt, I want to congratulate you. It's rare that an individual member of Parliament is able to achieve consensus on a bill and get it through the House of Commons and hopefully the Senate as quickly as possible and become law. So kudos to you, and thank you for showing Canadians that as opposed to the drama that they often see in question period, there are ways for committees and parliamentarians to work together pragmatically to achieve consensus and create a good bill. And I think we're going to be doing that here today. Just wanted to say a couple of things. The first thing is, as everybody understands, because Mr. Genru has submitted a private member's bill, it's not a money bill. So we're not able to amend the bill to extend paid leave. We can only amend this bill to extend the unpaid portion of the leave. And what we tried to do, looking at the way that we can provide it to the most possible Canadians, we've agreed that the best way to do it is bereavement leave, which encompasses everybody who's losing an immediate family member, and also now will include caregivers. So instead of a caregiver getting a certain amount of time, depending on where they were in the 28 weeks, all caregivers and all individual Canadians who lose immediate family members can get the 2 weeks, of which 3 days are paid and 7 days now would be unpaid. So, Matt, I just was wondering if you would tell the story that you were originally told in the House of Commons as to why this was so important to you and why you introduced this bill.
Yeah, thanks, Anthony, and echo everything you said about the drama of question period being just that kind of 50 minutes that we all experience. There's a lot of good work that happens at committees, and honestly, having Anthony reach out to us very early on, and then dealing with the minister's office as well, has just been nothing but a smooth process in terms of getting hopefully a good piece of legislation out of this. The story feels like I've told it a million times, but never one that I tire of sharing. It stems from when I first was left university. I got a job at a organization here in Edmonton, and I was competitive with a number of other individuals who had been hired with me for basically 5 of us for basically 2 jobs. Right around that time, my grandma had dementia and Alzheimer's and started deteriorating rapidly. I had the opportunity to go and either spend her final days with her, and my grandma and I were very close. Spend the final days with her, or stay at work and try to climb the corporate ladder, if you will. I ended up making a decision that I regret to this day, and I stayed at work and tried to climb that corporate ladder. Unfortunately, Grandma passed, and I didn't get a chance to spend the time with her or say goodbye to her. But I always thought, if there's something in a way somehow to encourage others to not have to make that decision, and knowing that there's protections in place, these sorts of are the reasons why have really pursued compassionate care leave and bereavement leave to a level that I think we're close to helping out more Canadians, so they don't have to make those decisions in the future.
Thanks so much. Et Monsieur le Président et ma collègue Madame Chabot.
And Mr. Chair and my colleague Madame Chabot, because I think there's enough consensus on the amendments and on the act before us. Is it possible that we could keep the witnesses with us, pass these amendments, and then do the 3 motions of Madame Chabot? Yes, I'm completely ready to do this. Thank you very much.
Thank you, Mr. Housefather. Merci, Madame Chabot.
And thank you, Madame Chabot.
Colleagues, that finishes our rounds of questions. We're now ready to proceed to clause by clause, following which we will entertain the motions presented by Madame Chabot. So at this time, I would like to say to our witnesses, thank you so much for being with us. Thank you so much for the work that you do, and for your support of this bill. We are now going to proceed with a clause by clause consideration of the bill. You are welcome to stay, but you're free to leave. And we are actually going to suspend very briefly because we are going to bring in a couple of officials who will be there to provide us with any assistance that we need as we go through the clause by clause. So just for the benefit of the parliamentarians here, these officials aren't here to be questioned or to provide testimony, simply to support us if there is anything that comes up in the course of our clause by clause examination that requires further policy advice. So with that, thanks to everyone. We stand suspended.
Chair, it doesn't have to be on the record, but I just want
back to order. Today's meeting is to consider Bill C-220, an act to amend the Canada Labour Code, Compassionate Care Leave. Before we begin clause by clause, I would like to welcome Douglas Wolfe, Acting Director General, and Sébastien St. Arnaud, the Manager of Strategic Policy, Analysis and Workplace Information Directorate from the Department of Employment and Social Development, who are available to answer policy-related questions in the context of the bill. So, colleagues, you have the bill before you. We will proceed now with clause by clause, and I call clause number 1. I understand that there is an amendment that has been submitted called Liberal CPC 1, so I invite Mr. Housefather to speak to the amendment.
Thank you, Mr. Chair, and then I'll turn it over to Mr. Genereux if he wants to add anything. I would advise colleagues that this is actually quite historic. I believe this is the first time that a committee has actually seen a motion or an amendment labeled Lib CPC 1. It's usually always Lib 1 or Con 1, and it was actually quite tricky to find a way to make sure that this got done this way. So I want to thank the staff to in the clerk's office that found a way to create a joint amendment from two different parties, and I hope this happens more often in the future. This is the substantive amendment we're offering. It basically changes the bill to, instead of extending compassionate care leave, it extends bereavement leave by 5 additional days. So instead of 5 days of bereavement leave, now everybody eligible for bereavement leave can have 10 days, and it also extends bereavement leave to include all those employees who were on compassionate care leave or leave related to critical illness at the time that their loved one passed away. So it extends the universal bereavement leave, and it extends bereavement leave by 5 days, which I think well achieves the objective of Mr. Genereux's bill, but also creates a level of fairness so that everyone who was on compassionate care leave gets 10 days, and a wider universe of people also gets 10 days. Thank you, Mr. Chairman, and I hope everyone will support it. Thank you, Mr. Chairman.
Thank you, Mr. Housefather. Mr. Genereux?
I think you guys have heard lots from me today. I'll just echo what Anthony said. I think the creating that larger scope really does make a ton of sense. The focus of compassionate leave obviously was the caregiver. We're not losing sight of the caregiver. The caregiver stays the same, and I think that's an important piece of this. But the expanding it to all types of bereavement, I think, are very key. And thanks thanks again to Anthony and particularly Minister Tassi for proposing that amendment.
The floor is open for debate on the amendment. Please use the raise hand function if you wish to intervene. Seeing no hands raised, I presume we're ready for the question. Shall amendment Lib/CPC1 carry? All those in favor, please indicate if we can proceed by consensus or whether a standing vote is required. I see lots of hands up. I read consensus in the room. It is carried. So clause 1 is now amended. Shall clause 1 as amended carry? I see consensus. Thank you. We're now ready to proceed to clause 2. And I understand that there is an amendment entitled Lib CPC 2. In the interest of fairness, I think we'll start this time with Mr. Genereux as one of the co-sponsors of this amendment. Mr. Genereux, would you like to speak to the amendment, please?
Yeah, thanks, Mr. Chair. So this is, I touched on this in part of the testimony, the importance of adding the 3-month piece after the bill receives royal assent, making that allowing for collective bargaining agreements and other sorts of administrative details to be ironed out before it comes into force makes a lot of sense, and I think again it was astute on the parliamentary secretary for catching that and making that a part of this legislation.
Mr. Housefather?
Nothing more to say. Mr. General covered it all.
So you have the amendment before you, colleagues. Are there any further interventions? Seeing none, I guess we're ready for the question. Shall Amendment Lib CPC 2 carry? I see consensus. The amendment is carried. So that brings us to the title.
Mr. Chair, don't we have to vote on clause 2 before we get to the title?
Well, I'm not sure there is a clause 2 in the bill, but for this, yeah, I believe in
Mr.
the
Chair,
bill itself.
if you want me
go
to
ahead.
if you want me to explain
please.
the situation, because the Lib CPC2 was a new clause. When you adopted the amendment, you adopted the clause at the same time. There is no need to vote on clause 2.
Okay, thank you. And while we have you, I know that the notes before me indicate that there is not a requirement to vote on Lib CPC 3, which relates to the title. Perhaps you can provide an explanation to the committee as to why that is not necessary. I don't understand it.
Okay, no, it's fine. I think you can go ahead and ask the mover to move the Lib CPC 3 and ask the question for the adoption of the amendment. And after, you can ask the question for the title as amended. Go ahead like this.
Thank you.
Forget my note.
Okay, I'll go ahead. Okay, colleagues, in case you're wondering, that was the sage advice of the Legislative Council, who I did meet with earlier today to take me through some of the procedural and legal technicalities. He's here to support us and the chair, as are the witnesses on the screen. So that brings us then to Lib CPC 3. Mr. Housefather, would you like to speak to that amendment as it relates to the title?
Oui, Monsieur le Président.
Yes, Mr. Chair. It's simply an amendment to change the title to reflect the changes that we've already brought through the first amendment to the Act, and we will now change the title to bereavement leave. And I know that my colleague, Madame Chabot, did not think it was the right way of saying this. I agree maybe, but I looked at the Act and it's already what it's called. The bereavement leave is congé de décès in French. So to be consistent, we will use it. Thank you, Mr. Chair.
Vous ajoutez, Monsieur Généraux?
Do you have anything to add, Mr. Généraux?
In agreement, I saw Ms. Chabot's, Madame Chabot's note as well, and I guess it makes sense if it's throughout the rest of the Act. Makes sense to keep it consistent.
Okay. Are there any further interventions with respect to Lib CPC 3? Seeing none, we're ready for the question. Shall Amendment Lib CPC 3 carry? I see consensus. Thank you. So that then brings us to the title. Shall the title carry?
As amended.
Shall the title as amended? Yes. We see consensus. It's carried. Thank you. Shall the bill as amended carry? It's carried. Shall the chair report the bill as amended to the House? And that's carried. Shall the committee order a reprint of the bill as amended for the use of the House at report stage? And that's carried. Thank you very much, colleagues. And Mr. Généraux, congratulations. Congratulations on getting the bill to this stage. It it really is a testament to your ability to work across party lines, and really gracious of you also to share the credit for that, because it is deserved all around. From all too often we're politicians, but from time to time we're parliamentarians, and this is one of these days. And you've made us all proud. Thank you.
Thank you, Mr. Chair. Again, my highlights, my comments at the beginning, thanking you for making this a priority. And since we have them here, Mr. Wolf and Mr. St. Arnaud, thank you. I know they probably put some work on your desk from this coming forward, so do appreciate all the time you spent on this too.
Well done, Matt. Well done.
Okay. Once again, to our friends from ESDC, you're welcome to stay, but you're free to leave. We are now going to move to the consideration of the motions brought forward by Madame Chabot. À vous la parole, Madame Chabot.
You have the floor, Madame Chabot. Thank you, Mr. Chair. And I would like you to notice that I'm making a lot of effort with my mic. So the three motions that were filed and translated in proper form, these are routine motions. And if I could qualify them, they really are motions of goodwill. The goal would be, in order to improve our governance as parliamentarians, but also to support the work that I congratulate of our interpreters in our work with the two official languages. So the first motion concerns the documents. Shall I present all three, Mr. Chair? It would probably be a good idea to speak of each one at a time, please. One at a time. Good. So the first concerns the documents translated by the Translation Bureau. The aim is that all documents that are presented for committee business, but that do not come from a federal department or that have not been translated by the Translation Bureau, so they're coming from elsewhere, that they be sent for prior linguistic review, at least, by the Translation Bureau before being distributed to members. Thank you, Madame Chabot. As usual, if anyone wants to speak, raise your hand. And before doing this, I just have one question for our clerk, a technical question.
For any comment with respect to the motions, how they interact with what we've already done.
In terms of the motion for the translation of documents, it's really just a matter of what the will of the committee is in terms of just managing to ensure that the quality of the communication is there for all members in both official languages. The only area, because the motion of this one does not speak specifically about documents from the clerk, for example, whether those documents need to be translated as well. But really, it's the will of the committee what they choose to do. But it's a matter of just ensuring the communication is as efficient and smooth as possible in both languages, and that's the key quality of this motion.
Okay. Thank you. I recognize Ms. Doncho, please.
Thank you, Mr. Chair, and I thank the member for bringing forward this amendment, and I recognize the importance of respecting both official languages in Canada and deeply appreciate the goal she's trying to achieve with these motions. One concern I have with this motion, or one thing that I'd like to see changed, is that members' offices are also excluded. So I would put forward an amendment, a motion to amend this motion, that it would say that all documents submitted for committee business that do not come from a federal department or a member's office, or that have not been translated by the Translation Bureau, be sent for prior linguistic review by the Translation Bureau before being distributed to members. And I know that this amendment, a very similar one, was put forward at the Canada-US Trade Committee and was appreciated by the committee there and implemented. So I'd ask the committee to consider this amendment.
Thank you, Ms. Doncho. The amendment is in order. So the debate now is on the amendment. Any submissions with respect to the amendment proposed by Ms. Doncho? Mr. Housefather, please.
Oui, j'aimerais juste avoir.
Yes, I would just like to have the chance to explain this amendment to Madame Chabot in French. So it was an amendment that we adopted Tuesday evening, I think, at the U.S.-Canada Committee, proposed by Mrs. Alice Lev at that point. And it's just to clarify what is being described in the document that I support. It's the question of documents that come from a third party that have not been translated by the Translation Bureau, and I agree with 100%. But we made an exception at the U.S.-Canada Committee to say that if it comes from the office of a member, where generally it's the Translation Bureau who's already translated the document, or their parliamentarians where we trust that it's not a problem. It's just the documents from third parties that come to Parliament where that have to be sent to the Translation Bureau. So I agree with the amendment presented by Mrs. Gancho, because that was the initial intention. It was already adopted by our committee. Thank you, Mr. Housefather. Madame Chabot. Thank you for having so well understood my intentions. Yes, and I think we know that some offices have translation offices, so I would be happy to include your amendment, Mrs. Dancho, and I hope I'm pronouncing your name right.
I think we can now consider this a friendly amendment and move straight to the amended motion. Are there any further interventions with respect to the motion as amended? Seeing none, I think we're ready for the question. You have the motion before you. The amendment is to include members' offices to broaden the potential source of the documents that need to be translated. So as I say, I believe we're ready for the question. So do we have consensus, or do we require a standing vote to pass the motion as amended? Let's just, all those in favor, can you indicate? I believe, yes, I believe okay, I see consensus. Thank you, colleagues. Madame Chabot, la deuxième motion, s'il vous plaît.
Madame Chabot, the second motion, please. So it was adopted. The first one has been adopted, has been carried. The second one concerns the technical tests, the sound tests, and I have to acknowledge that the committees, this is going better and better with time, if I think about what the situation was when we started. But it's a major issue, because when we have to work as a committee and we welcome witnesses, we have to make sure that the material and the technical tests have been carried out properly. You also, Mr. Chair, sometimes have not been able to hear a witness because the tests were not carried out earlier. So that's the goal, to inform each witness who's to appear before the committee that the House Administration Support Team must conduct technical tests to check the connectivity and the equipment used to ensure the best possible sound quality. So not put our mic on the top of our heads, and that the chair advised the committee at the start of each meeting of any witness who did not perform the required technical tests. In that way, we will be able, as a committee, to know ahead of time of any issue that might occur. Thank you, Madame Chabot. Discussion on the motion? Please use the function for raising your hand on your screen.
For the question. All those in favor of the motion as presented, please indicate. I see consensus. The motion is adopted. La troisième motion, Madame.
The third motion, Madame Chabot. Thank you, Mr. Chair. The third one is related to the motions that come up. So the routine motions. So that the text of any substantive motion or any motion in amendment of a substantive motion be distributed in writing in both official languages to all committee members before the committee begins debate on such a motion. I would say that we have recently experienced something like this, and that we were able to adapt. Mr. Barkin had proposed an amendment recently, and we asked that it be written out and to be translated. So the goal is not to limit debate, but it's to make sure that when we will vote, we have the tool written out in both official languages. Thank you, Madame Chabot.
For you, are there any interventions? Ms. Dancho, please.
Merci, Monsieur le Président. Pour cet amendement, j'ai beaucoup de...
Thank you, Mr. Chair. For this amendment, I have many questions. I don't think it would work very well. Today, just 10 minutes ago, I proposed an amendment, and it did not have the translation, but it worked very well. I think it's a privilege for the MPs to have that right to propose amendments on the floor, and I think that this motion would not allow this to work. Thank you, Mrs. Dancho. Any other comments? Madame Chabot? You're entirely right, Mrs. Dancho, on the procedure that we should be able to file motions. There are rules that they should be filed 48 hours ahead of time. But on the floor, yes, we must be able to do this, to introduce amendments to substantive motions. But the goal, if we want to understand what we are voting on, would be to have this. It's difficult to have it when things are moving quickly. We didn't experience that too often here. If it's not translated, if it's only verbal, that we have all the tools necessary to carry out our vote properly, which is what we need to do, both in committee and in parliamentarian work. Mr. Housefather. Thank you, Mr. Chair. So this motion was rejected at the Canada-U.S. Committee exactly for the reasons mentioned by Mrs. Dancho. We just had received this proposal of Madame Chabot, and Mrs. Dancho brought an amendment, and we didn't wait until the clerk sent an email to everyone to send the amendment in French and English, and it's difficult for the clerk to undertake this translation. What we have already is a process where if it's a motion that is 48-hour made 48 hours ahead of time, it's translated. And really, in the committee, it depends on the chair. It's the chair who must determine that everyone is able to clearly understand the motion or the amendment before it's voted on. And if there's a member for whom it's not completely clear as to the meaning of the amendment, we have to stop and ask for translation. And until this point, it's worked well. So I didn't think it was necessary to adopt such a proposal. But if we see that there's a problem, if there are motion amendments that are not understood and we're being asked to vote on, I can understand the goal of this, but the way it's written, maybe it would bring up to delays that aren't necessary. So maybe Madame Chabot could look at this to see where it would be necessary. And now I really need to vote against it because it's too demanding. Thank you, Mr. Chair. Madame Gazan?
Yes, I'd just like to echo the comments of my respected colleague Anthony Housefather and Raquel Dancho. I as well will not be voting in favor of this motion. Thank you.
Thank you, Ms. Gazan. Madame Chabot.
Well, without wanting to prolong the debate, but it seems important for me when we vote that it be clear. If I would propose an amendment to my motion, which would say, before the committee votes on a motion, the goal is that if someone does it, we don't want to interfere or prevent debate. So it's not expecting to have the motion written in both languages to initiate debate. As you said, the chair can do that. But when we come to the time of voting on the motion or the amendment to the motion, that this be possible. So my amendment would say, rather than saying before the committee begins debate on such a motion, it would be before the committee votes on such a motion. And Madame Chabot? We have a small technical problem. Well, it's not really technical, but a procedural problem. It's not possible to amend your own motion. So probably we have to follow the rules, and it would be to take back your motion and to present another one. So it's possible for our MPs to amend your motion, but not for you to do it. Madam Clerk, would you want to add anything to that point? No, you're right, Mr. Chair. If someone else wants to propose an amendment, that can be done. Otherwise, Madame Chabot could present a second motion if we remove this first one. Madame Chabot? So now I could present a second one? Yes, if it's the committee's will to withdraw this one. If it requires a unanimous consent of the committee. Well, first of all, you need to withdraw the motion that's before us, right? That was a question for you, Madam Clerk.
For the sake of good order, given that there is a motion on the floor before us, would it not be necessary for Madame Chabot to either have the motion defeated or to withdraw it before presenting a new one?
Alors, il faut simplement faire consentement unanime pour avoir...
So we simply need unanimous consent to withdraw the motion and proposing a second motion with amendments. I understand.
Just to allow Ms. Chabot to withdraw this motion, and that's all I need is unanimous consent to withdraw the motion. I see consensus. Okay. La motion est enlevée. À vous.
So the motion is withdrawn. You have the floor, Madame Chabot. If you want to present another motion, please go ahead. Well, it will be the same text. It won't have been translated into the other language. That the text of any substantive motion or any motion in amendment of a substantive motion be distributed in writing in both official languages to all committee members before the committee proceeds to the vote on such a motion, or begins the vote of such a motion.
Oui, Monsieur le Président.
Yes, Mr. Chair. So, with all respect to Madame Chabot, my friend, this was an amendment that was also brought to the Canada-US Committee, which was defeated by everyone because look at the example. You've just presented a new motion. We don't have that motion in writing in English, so the clerk will have to find a mean to send an email to all committee members with the text in English. And who will be doing the translation? Would it be you? Would it be me? Would it be the clerk? So we found. So I'm happy, and I'm always promising if there are amendments that I will translate them for you. I'm happy to do that. And the interpreters also do it. But maybe you could rethink this motion and what you're really seeking to achieve and come back with something else, because I don't think this works. It will really bring out delays. And the last clerk at the Canada-US Committee said she was very uncomfortable with that idea. She was not comfortable translating the documents herself. Thank you, Mr. Chair. Madame Chabot? Yes, well, I raised my hand to say I understand that it wasn't adopted at another committee, but I have the privilege of being able to propose it at this committee and to see whether, in terms of my colleagues, of the MPs who were with us at this committee, these parliamentarians, if in our way of functioning, the new motion that I've just presented, and I was very aware when I did it, because the procedures allowed me to do it, but it went against the goal that I was presenting in the motion. So I was allowed to present this motion today. So my motion really deals with what's going on now. We can carry out the debate without having the motion in writing in both languages. But at the time of the vote, if we have to make sure that we're voting on the right thing, properly translated in both languages. That was my concern. But I want to do it, and it's up to you to deal with it, dear parliamentarian colleagues. Madame Gazan?
Yes, in agreement with my colleague Anthony Housefather, I will also not be supporting this motion. Thank you.
Any other interventions on the new motion? Seeing none and sensing that we do not have consensus, I call the question and ask the clerk to proceed with a roll call vote, vote par nominal. Allez-y, s'il vous plaît.
So the vote is on Madame Chabot's motion. Mr. Dong.
I vote against.
Mr. Wayne. Mr. Long.
Against?
Mr. Housefather.
Vraiment déçu, mais contre.
Mr.
Disappointed but against.
Contre.
Miss Yost.
Je suis contre.
I'm against.
Show.
Against.
Miss Falk.
Against.
Mr. Generou.
Against.
Mr. Viss.
Against.
Madame Chabot.
Pour.
For.
Gazan.
Against.
10 nays, 1 yay.
I declare the motion defeated. Is there any other business to come before the meeting? Is it the will of the meeting that we adjourn? I see consensus. Before we do adjourn, we do have this evening, colleagues, now a scheduled meeting of the subcommittee to proceed in camera. So for those of you that are on the subcommittee of procedure and agenda, take 10 minutes to stretch your legs to give us time to get switched over, and then please log in with the credentials, the separate credentials that you have been given for the subcommittee meeting, because they are not the same as the ones that we are on now. So if everyone could please log out, and those of you who aren't on the subcommittee, have a wonderful evening. Those of you who are, please log back in 10 minutes. Thank you. We are adjourned.